The number of married women in Malaysia infected with HIV has tripled in the past 10 years. Now, partly in reaction to this, Malaysian authorities have now made it compulsory for all Muslim couples to test for the virus before marriage. But even if the move can be considered a scientific response to public health concerns, critics say it completely fails to take into account cultural and social factors, and it may end up causing more problems than it solves. I'm Taimur Nabili, and on this edition of 101 East we ask, is it good public policy to force couples to reveal their HIV status? There have been major advances in medicine that have meant an enormous increase in the length and quality of life for HIV carriers. Nonetheless, many of them still see the virus as a death sentence. Chan Tao Cho reports now on the problems that many Malaysian couples face when HIV screening reveals a positive result.
More than 2 decades ago, when HIV/AIDS was first discovered, it was seen as a death sentence. Those most at risk were thought to be homosexuals or intravenous drug users. But in Malaysia today, the HIV infection rate has fallen among those groups. Instead, more and more women at home are getting it from their spouses.
I'm not a drug user, I'm not sex worker, and I'm not the change of partner recently. Maybe it's from my ex-partner. I want to stop public to say that HIV positives must be not good person. Stop to say this is a punishment for the God.
This woman is HIV positive. Before she got married recently, she had to do a mandatory screening for HIV/AIDS. She was confirmed an HIV carrier while he tested negative. They do not want to be identified for fear of upsetting his family.
People will say, is he wise or is he crazy? I know how HIV spread, and then I am prepared. I have to, have a safe sex, whereby I have to, each time I do, I have to use condoms, and then I don't share a toothbrush, shaving, shavers and all that. How, and then when she have, fresh wounds, I should not touch it if not being protected. So it's just a question that you are knowledgeable, then you don't have to worry.
But authorities are worried. After all, the United Nations estimates more than 80,000 Malaysians live with HIV/AIDS. In this country where some 2/3 of its population are Muslims, the government has reacted by making it compulsory for all Muslim couples to undergo HIV screening before they get married. Previously, this was only applied in certain states.
Kita merasakan ujian ini perlu dan ia mesti diwajibkan, bukan sukarela.
We think the test should be mandatory to prevent harm from one party to another in a marriage. We don't want to stop people from getting married. From this screening, we can inform the couple if we find any of them HIV positive. The Islamic authorities, together with the health ministry, will provide counseling for the couple, and they can choose whether or not to go on with their wedding.
Based on 2007 figures from states that already had this policy, 8 out of 9 affected couples called off their wedding. But this couple resisted pressure from religious authorities to do so.
They were trying to discourage. Their main intention was to stop the marriage.
Raymond Tai is from a Malaysian NGO that helps people living with HIV/AIDS. He takes issue with how the test results are used.
Would the results be confidential? Would the parents of either spouses be informed about the status? Would there be a lot of pressure on the couple to stop them from getting married? Would the entire village know about the status? So these are some of the safeguards that I don't think has been carefully thought about.
More important than mandatory screening, he feels, is the need to impart knowledge on how HIV is spread and ways to prevent it.
Even if they're negative down the road, don't forget there is a window period of 3 months as well. So just because you get tested doesn't mean that you are negative.
And it's the lack of such medical knowledge among the general public which worries Professor Adeeba Kamarulzaman. She heads the Infectious Diseases Unit at the University Malaya Medical Centre.
People need to realize that there's been so much advance in the world of HIV. Recent studies have shown that you will live to at least 49 years from the time you start treatment.
Also, medical advancements have made it safer to have a child.
Now, if the mother is HIV positive, what we do is give her the same anti-HIV treatment at certain points in her pregnancy to bring the level of the virus down completely. And during labor and during delivery, we once again give medications to reduce the chance of transmission. In the past, when this was not done, the risk of the child being born HIV positive is about 1 in 3. These days, the risk can be as low as less than 2%.
That's good news for this couple who hope to have a daughter.
Then my suggestion is if you want to getting married with a HIV woman, getting married because the woman will appreciate you more than a normal person.
We are normal human beings. We want to share love, we want to be loved, and then, so I think she deserves it. It's not easy.
It's not easy, yeah. It's not easy.
Well, joining me now in the studio are Dr. Ma'amor Osman, Secretary General of the Muslim Consumers Association, Marina Mahathir, Advisor to the Malaysian AIDS Council, and Ben Monteiro, an outreach worker for Positive Living, a service program for people living with HIV/AIDS. Thank you all for being here.
Yeah.
Doctor, may I begin with you, purely with the practical element.
Okay.
What is the logic behind making this mandatory?
Okay, we understand that Islam is more about preventions. And most of the diseases are preventable. And saying says that the prevention is better than cure.
Prevention is all well and good as a noble aim, but is this the way to do it?
There are many ways to do it, but if you don't start some things, so you might propagate the disease if they fall into the people who don't understand how the disease is being transmitted.
Is there any evidence anywhere in the world that testing couples who want to marry is going to prevent the spread of HIV?
Not mandatory testing. Voluntary testing, yes. Voluntary testing with counselling and ensuring that it's confidential, yes, it has worked everywhere. But mandatory testing programs have failed all over the world, has not prevented...
Well, sure, but I don't understand why, if you're forced to, it's less successful than if you do it voluntarily.
Well, because it's something that you're doing because you have to do, so you're not thinking about it. And there's a lot of evidence that the counselling is not happening. We've had people on the ground saying all that happens is they say, stick out your arm, we take your blood, they go and test it and say, okay, you're positive or you're negative, and that's it. And the opportunity for education and all that is just lost. The other thing about it is that if you have a negative result, but you're not counselled about changing risky behaviours if you have it, then it gives you a sense of complacency. You think you're fine for the rest of your life. But we have a lot of women, in fact, who've been married 10 years, 15 years, whatever, then they get infected. We have 60-year-old women who get infected.
There has been testing, mandatory testing, in some parts of Malaysia for a while now.
Yes.
The practical impacts from someone who works with people with infection, how has this affected the social situation, the practical situation?
Because, yes, all these people that have been tested, then, I mean, that fear in them, and they don't go for their follow-ups because the fear of other people knowing about their status. So this is the thing that keeps them away, drives them underground.
You disagree with that?
When you ask it's mandatory, the responsibility also falls on the government side. If it is compulsory, and the government must prepare to teach them, to take care of them, so not to give a knowledge to them, and also the government must give free testings, and there's no charge for them.
You know, when you talk about the government, I think we should talk about how policy is made in this country. For example, we have needle and syringe exchange programs in this country. How that came about was there was a lot of consultation, there were a lot of papers presented, we provided the case for it, people argued about it, and in the end it was decided that this is what we should do to prevent HIV among drug users. But this policy, there was no consultation. It didn't even come from the Ministry of Health. It came from the religious department, which puts a different tint on it altogether. Because why is it that they are making health policy, whereas it's the role of the...
Particularly health policy that is not taking account of any of the other races in Malaysia.
Sorry, they're not making the health policy, they're suggesting, because there are a lot of cases reported that after they get married and they know the partner quietly having HIV. So when then what next? So most of them, they ask for divorce.
But there are also people...
The moment they ask for divorce, there's a lot of complications.
All right, let me stop you there for a second.
Yeah.
We'll take a short break. We'll come back in a moment or two. And when we do, we'll take a look at how one woman has been coping since she contracted HIV from her former husband. Stay with us. We're back in a couple of minutes.